Welcome to Cartoon Galaxy, your NEET PG OBG revision guide. Dr. Manish here. Obstetrics and gynecology is a huge part of NEET PG, covering women's health across their lifespan. To help you crush this section, we'll break down the most high-yield OBG topics you need to know. Stay with me to the end for some golden MCQs to boost your prep. Let's get started. So, you delivered the baby, but the journey's not over. Puerperium, the postpartum period, is the 6 to 8 weeks after delivery. The uterus starts shrinking back to its normal size. That's uterine involution. This period isn't always smooth sailing. One of the scariest complications is postpartum hemorrhage, PPH, a medical emergency. You need to know the risk factors, types, and management. Another complication is puerperal sepsis, a severe infection during the postpartum period. Think fever, chills, abdominal pain, red flags. Know the causes, bugs involved, and aggressive treatment. Remember those MCQs I promised? Here's one. What's the most common cause of PPH? Think about it, I'll give you the answer later. Understanding puerperium is non-negotiable for NEET PG. Stay sharp and be prepared for these critical scenarios. Let's move on. Time to talk about preventing those bundles of joy. Contraception is a huge topic for NEET PG. First up, barrier methods like condoms, they prevent pregnancy and STIs. Then we've got diaphragms and cervical caps. Next, hormonal methods like the pill, patch, and ring, they prevent ovulation. Know the different types, side effects, and suitability. The copper T, an IUD, prevents pregnancy for years. Don't forget emergency contraception, the morning after pill. MCQ time. Which contraceptive method is most effective in preventing both pregnancy and STIs? Think carefully. Mastering contraception means understanding mechanisms, effectiveness, and suitability. Let's keep going. Infertility can be tough, affecting both men and women equally. Let's talk about common culprits. For men, low sperm count, abnormal morphology, and poor motility are big issues. Hormonal and anatomical problems also play a role. For women, tubal blockage due to infections like pelvic inflammatory disease is common. Ovulation disorders like PCOS cause hormonal imbalances. Treatments include medications to stimulate ovulation and surgery to correct anatomical issues. IVF, in vitro fertilization, is a game changer, fertilizing the egg outside the body and implanting the embryo back into the uterus. Know the indications, procedure, and potential complications. Here's your MCQ. What's the most common female factor contributing to infertility? Got your answer? We'll find out soon. Understanding infertility means connecting the dots between causes, investigations, and treatments. Stay informed and empathetic. On to the next topic. Let's talk about gynecological cancers, a serious topic for NEET PG. The big one is cervical cancer linked to the HPV virus. The HPV vaccine is a game changer, and screening with Pap smears is crucial. Ovarian cancer is tricky, often silent in early stages. Look out for vague symptoms like abdominal bloating, pelvic pain, and unexplained weight loss. Early detection is key, but it's often diagnosed late. Endometrial cancer affects the lining of the uterus, with abnormal bleeding as a major red flag. MCQ time. What's the most important risk factor for cervical cancer? Think about it. With gynecological cancers, knowledge is power. Be aware of risk factors, screening methods, and early signs. Stay vigilant and proactive. Let's keep learning. Next chapter. Last chapter, let's talk about menopause, marking the end of a woman's reproductive years. The decline in estrogen levels leads to symptoms like hot flashes, night sweats, and vaginal dryness. Long-term estrogen deficiency increases the risk of osteoporosis. Hormone replacement therapy, HRT, can help manage symptoms and protect against bone loss. But it comes with risks, like blood clots and increased cancer risk. Final MCQ. What's the most effective treatment for severe hot flashes associated with menopause? Got your answer? We'll find out soon. Understanding menopause means providing holistic care. Address both physical and emotional aspects. Let's wrap this up. And there you have it, the must-know topics in OBG for NEET PG. We covered a lot of ground today. Now it's your turn to dive deeper into each topic. Hit the books, practice those MCQs, and stay tuned to Cartoon Galaxy for more awesome medical content. Here are the answers to those MCQs. For PPH, the most common cause is uterine atony. For contraception, it's condoms. The most common female factor for infertility is tubal blockage. The biggest risk factor for cervical cancer is HPV infection. For severe hot flashes, HRT is often the most effective treatment. Keep up the amazing work, future doctors. Smash that like button, subscribe to Cartoon Galaxy, and share this video with your study buddies. Until next time.